Marius van Rijnsoever. I'm a gastroenterologist, and today in 5-minute lectures I'll be talking about hepatitis B. Now, always ensure you follow your local guidelines and seek expert advice if you're unsure. Now, hepatitis B is a very common virus and it affects about 250 million people worldwide and is responsible for 1 million deaths per year. Now, it's mostly vertically transmitted, which means the baby gets exposed to blood with the childbirth and then develops a chronic infection. This happens in about 90% of babies that are exposed and are not vaccinated. However, if you get this later in life, about 90% of people clear the virus and only 10% of people develop chronic carrier phase. Now, other ways of being transmission is blood to blood, with needles, drug use, as well as with sexual transmission. Now, determining hepatitis B serology is actually really simple, but quite often is very misinterpreted. Now, first you need to see if there's any active infection. So look for the hepatitis C surface antigen. So the antigen means it's the actual virus itself. Now, the next step, if that's not present, you want to look to see has the patient previously been exposed to hepatitis B? And you look at that by looking whether there's a core antibody positive. That means they've had past exposure, as the core is not present in any vaccinations. Now, lastly, you wanted to look at the surface antibody, and this is the antibody that gets present with vaccinations to see if they are immune. To determine the management of hepatitis B, one first must learn the 4 different phases in the natural history of hepatitis B. As a child, there is the immune tolerance phase, where there's very high viral load, but there is no liver inflammation, and there is a normal ALT, and there is no damage being done by the virus. In the second decade of life, the immune system can recognize the virus is there and create extra antibodies against what's called the E antigen, which is an antigen that's present on the surface of the hepatitis B. This then causes an immune response where the immune system fights and clears any infected liver cells, causing a raised ALT. With the extra antibodies, the patient can then go into the third phase, which is called the immune control phase, or what's called sometimes misleading a carrier phase, where there is low viral load and low ALT, so there's no ongoing liver inflammation, and the immune system is really good in terms of controlling the virus naturally by itself. However, later in life, usually the 4th or 5th decade, the virus can be very clever and cause a mutation in the promoter gene of the E antigen. This switches off the protein, which means the virus does not make the E antigen anymore and therefore escape the immune response and the E antibodies that the patient has. Treatment of hepatitis B should be initiated by a specialized gastroenterologist. However, in general, we treat people with antiviral treatments such as tenofovir or entecavir when people are either in the immune clearance phase, so they are seroconverting and creating more antibodies, or when they're in the immune escape phase, so when there's active liver inflammation or when people are cirrhotic. And we treat people with cirrhotic regardless of when they've got viral load or raised ALT and liver inflammation. A Chinese study also randomized pregnant women to placebo versus tenofovir and found that the risk of vertical transmission increased when the viral load was greater than 10 to the log 6. And therefore we treat pregnant women in the 3rd trimester with tenofovir if they've got a high viral load. And we continue this 6 months postpartum and then stop as if the patient does not require the treatment for themselves. Now, some patients remain in the immune tolerance phase, and we know that the risk of liver cancer has a linear relationship to the viral load. So the more virus there is, the more risk for cancer and also the higher risk for cirrhosis. Now, recently the special authority requirement has been removed in New Zealand, and prescribing antiviral treatment can be done regardless of any specific criteria. And therefore we're also starting to treat people that remain with high viral loads in their 40s and 50s, and we can actually prevent them going into cirrhosis and reduce their liver cancer risks. Now, I hope you enjoyed this brief overview from hepatitis B. In New Zealand, I also just want to mention that we've got a fantastic hepatitis B foundation, which offers fantastic service to monitor these hepatitis B patients with regular blood tests and refers them on to specialists if required. Now, feel free to contact me directly or consult your local gastroenterologist if you've got any specific questions or patient's concerns. Thank you.